Good morning, good afternoon, good evening to some. So I'm Jean-Pierre Nyemazi. I'm the acting director for the Quadripartite Joint Secretariat, and we provide secretariat functions to the Global Leaders Group. And we are happy to have this webinar today to discuss the relevance and importance of the integrated surveillance for antimicrobial resistance and antimicrobial use. I would like to thank Professor Lothar Wheeler, who is the GLG member who has been steering this work for a couple of years now. I think 1 year and a half. He has been dedicating his time and leadership to ensure that this work really goes fast and well. So Professor Wheeler, I will not take much time. I would like to give you the floor to moderate the session.
Thank you so much, Jean-Pierre. I hope everybody can hear me. If you raise your hands, thumb up. Is it working? Can you hear me? Great. So good morning, good afternoon, and good evening, everyone. I'm really delighted to be here at this session on the pocket guide for integrated surveillance. And actually, I'm particularly happy to have been able to contribute to the work of the GLG with my team and facilitate the session today. For those who don't know me, I'm Lothar Wheeler. I'm a speaker of the Digital Health Cluster and chair of the Department of Digital Global Health at the Hasso-Plattner Institute, where I have now been working for more than a year, moving on as president of the Robert Koch Institute, Germany's National Public Health Institute. I have been a member of the Global Leaders Group in AMR since November 2020, and I also represent and chair the GLG's task force on integrated AMR surveillance. Actually, we are here today because we all know and believe that AMR poses a huge threat to human, animal, and environmental health. It is in fact a leading cause of death globally, as shown by the comprehensive assessment of global burden of AMR by the IHME only recently. AMR has and continues to set us further back from achieving our public health goals, including an important sustainable development goal, namely attaining good health and well-being. But while we keep repeating this, we also know that the problem of AMR is extremely complex, and the solutions, therefore, are not easy. There still are many critical gaps that need to be addressed as part of all the efforts necessary to tackle AMR. One of these critical gaps clearly is surveillance. Sadly enough, we still do not have the entire picture, and sometimes we lack AMR and AM usage data entirely. In many countries, we lack data from most One Health sectors. And if we do have the data, they do not reach decision makers and practitioners at the right place and time. This inevitably leads to a lack of action or action and policy that is not informed by data or evidence, and clinical decisions that are not optimal for patients. This must change. We first need to understand what integrated surveillance means for our local and national contexts. We need these surveillance data to inform our national action plans. Simultaneously, we need to adapt our plans and efforts to local contexts to strengthen sector-specific work. These need to be brought together in an integrated and coherent way. As part of our work in the task force on AMR integrated surveillance, we created a pocket guide for political decision makers to show the need for actions that support integrated surveillance of antimicrobial resistance, AMR, and antimicrobial use, AMU, across all these sectors. This guide was aligned with the work of the Quadripartite Technical Group on integrated surveillance, which you will hear on later in this session by Chiniri. With this guide, we want to provide policymakers with the key facts about why surveillance is important and what they can do in their countries to set up and expand their surveillance systems. At the moment, AMR and AMU surveillance data are often fragmented and not representative. And to date, most surveillance systems do not yet include data from all health sectors, namely the human, animal, environmental, and agri-food sector. Surveillance requires data on AMR to determine changes in resistance patterns over time, and data on AMU to determine the number of antimicrobials used, which in turn helps to assess the risk of AMR resulting from exposure to antimicrobials. Actually, we need the support of policymakers to put AMR surveillance on the political agenda and into national budgets. And here are 5 reasons why you should build up integrated surveillance in your countries. First, good quality AMR and AMU surveillance data help identify and address outbreaks and spread of disease early on. Secondly, targeted evidence-based interventions can reduce the burden of AMR and help prevent suffering and save lives. Third, it makes a good economic case because it is more cost-effective to invest in good surveillance systems and develop targeted interventions to prevent AMR spread than to bear the costs of treating infections with resistant microorganisms and controlling outbreaks. Fourth, transparent data shows accountability to the public and builds trust. And trust is of utmost importance, as we all know and realized, at least lately under the COVID pandemic. And fifth, we develop a better understanding of AMR transmission and risk across sectors. So as the United Nations Statistical Commission has put it, and I quote here, better data saves lives, quote end. So we need to act now and support our local and national initiatives towards creating sound surveillance systems. Today, in our lightning talks, we will hear about different national and regional approaches of pioneers on integrated surveillance. Best practices we want to show you about how they managed the difficult task of bringing sectors together and finding solutions to review data together. We know that many of you have close connections to the Ministry of Health and policymakers in your countries and the Ministry of Agriculture. We have chosen this format of short, concise talks, 5 minutes talks. I have to remember the participants here, so that we can improve our communication with policymakers. And that's one of the most important topics of this session. We want to inform policymakers the way they understand our messages. Actually, and many of you know this, they often have only a few minutes to listen. So we need to make a convincing case, a so-called elevator pitch, as many of you know, with a few but strong arguments and a compelling story. In the panel discussion, we want to talk then later on about key questions and challenges to get more concrete on how we can advance on integrated surveillance. So with that, I now hand over to our first speaker, Chiniri Okoro. Chiniri is part of the quadripartite core team supporting the quadripartite technical group on integrated surveillance. Chiniri, the floor is yours.
Thank you very much, Lothar, and thank you everyone who is joining us on this webinar. Just wait for a few moments for the slides to appear. First slide, please. Next slide, please. So I would like to start first by reiterating a lot of, well, not going over a lot of what Lothar has introduced us to, but to emphasize that integrated One Health surveillance of AMR and AMU across all sectors is a priority area for the Global Leaders Group on AMR. Integrated surveillance is also a key priority area of work for the quadripartite. One of the activities and actions emanating from this priority is what I will describe in the next couple of slides. I would like to bookend this by reiterating that integrated surveillance of AMR and AMU is essential for a sustained, holistic, and coordinated global One Health response to AMR. Just as Lothar has emphasized, it's important because surveillance generates data and information for enacting this meaningful action. So without data, there will be no action. Next slide, please. Because it's a priority area for the GLG and the quadripartite, on the basis of this, the quadripartite established the quadripartite technical group on integrated surveillance at the end of 2022. And since then, the work has progressed significantly. And one of their key priority outputs is the quadripartite guide on One Health integrated surveillance of AMR and AMU. The QTGIS as a technical group is mandated to provide advice and guidance on the development of global and context-appropriate regional and country-level systems for integrated surveillance and establishment of capacities to undertake surveillance across sectors as well as within sectors. I would like to just draw your attention to the content of the guide, the technical guide, which the pocket guide complements effectively. And this technical guide is now in an advanced stage, and we're looking forward to getting that finalized and into the hands of implementers. The components of the guide include a definition of integrated surveillance. As we know, many countries are at different stages and have embarked on different systems, and it will be always useful to be able to have a unifying definition that everyone can benefit off of. And we will also outline a series of purposes for which integrated surveillance systems can be designed. We will also outline in this guide priority microbial targets, metrics and indicators which are used to measure and collect data across the One Health sectors. We will also outline in this guide resources and requirements for the different purposes for establishing and designing systems for collecting data across the One Health sectors. These three key components are underscored by considerations for implementation and operationalization of One Health integrated surveillance of AMR and AMU. And we recognize that different countries are at different stages and of implementation or establishment or of collecting data or integration. So with this in mind, it's very clear that we present a value-adding proposition for countries to be able to either establish or expand on the systems that they already have. We will also include illustrative examples for One Health integrated surveillance of AMR and AMU. Some of these examples will be presented some of these examples were presented in the following talks. I'll just mention very quickly. And this is again predicating on the fact that many countries have already embarked on exercises about collecting, which requires collection of data across sectors and ensuring the harmonization of this of the data in order to enact meaningful action. Some of these examples will include Tricycle and the CIPERS program, which will be which you also hear about in the next few slides. Next slide, please. So some of the themes that I've mentioned briefly, but which I'll reiterate in this slide, is that One Health integrated surveillance is guided by purposes for integrated surveillance. And this will put the power back into national authorities who will select specific purposes according to countries' needs, resources, and context, bearing in mind that countries will be at different stages and at different capacities. We also clearly emphasize that establishing or designing integrated surveillance systems will require a stepwise approach that builds on strengthening surveillance of AMR and AMU in each sector and followed by integration at one or more stages of the process. These stages will be outlined in the technical guidance. And we emphasize that you build on an existing protocols and systems, so countries are allowed to begin where they are. And it offers a selection of entry positions or entry points that suit the context of each implementing country. And again, this particular guide then offers, again, the value-added proposition that each sector can be centered in the integrated surveillance framework, which allows perhaps sectors that have been underrepresented previously or sectors that we don't have defined indicators, etc., for to continue to allow for continuous improvement in the face of emerging evidence. I will stop here and will be happy to take your questions.
Thank you, Chineri. We will have questions later on in the panel discussion. So we move forward to Peter Jan Skeesens. He's from the Unit Head of Antibiotics and Resistance, Cienzano, Belmec, Belgian platform for integrated surveillance.
Yes,
Peter.
thank you. Thank you so much for the invitation. I will share you the experience we have in Belgium with creating integrated surveillance. Next slide, please. So when it comes to surveillance in antibiotic resistance, you can basically measure two things. You can measure how much antibiotics are sold or used, either in human or an animal sector, or you can measure how resistant are the bacteria which you isolate from sick people or from healthy people. The thing is that this data is collected in most of the countries to a certain extent, but typically these surveillances are organized per sector and they have different primary purposes. For example, in the animal sector, resistance against critical antibiotics for human sectors are not tested. A second problem is that this is typically a mix of regional and federal competences and funding schemes. And third issue is that typically these organizations produce hard copy results and data is often not shared between institutes. And so next slide, please. So in Belgium, we started a few years ago with mapping all these surveillance systems. And only in a small country like Belgium, we identified 26 different data owners only for consumption and resistance of antibiotics. So we put these 26 people in the same room and we created, next slide please, the BelMap report, which is named after the DenMap report, obviously in Denmark. And this allowed us actually to accomplish three things besides obviously grouping of the data. First, it allowed us to truly compare the data across sectors. So for example, here in green, you see the consumption in the veterinary sector in Belgium. In blue, you see the consumption in the human sector, split between hospitals and community sector. So that is the first thing that we achieved. The second one is that on the next slide, is that we were allowed to create open access data. So we created a website where all the data is available. On the next slide, please. So which induces also, which is freely available for download and which creates transparency towards also the general public. And next slide, please. We also, by creating this editorial group of data owners, we, as was mentioned before, we talk with each other and we create trust because we realize that behind all data schemes, obviously there are people and you work with people, and when you trust each other, you can accomplish much more. So there is now also, we are in Belgium in a process of building a new national action plan for AMR, and through this integrated reporting scheme, we can talk with one voice how to improve our national surveillance schemes. Next slide, please. Final slide. So just to remind you that creating this integrated surveillance is actually a low-cost organic way of creating collaboration within the different surveillance systems and creating one voice. That's actually also, I just want to mention the EU JAMRAI joint action, which is actually trying to achieve this One Health reporting in 17 European member states. Thank you for your attention.
Thank you so much, Peter. Pretty cool, but I guess it has been a tough thing to get these 26 people into one room. That's very straightforward. Thank you so
Yes.
much. So we will discuss about this also later. So I now move on to Luc Samizon. He's director of the Centre d'Infectiologie Charles Mérieux and professor at University of Antananarivo. And his title is Experience with Tricycle in Madagascar.
Thank you very much, Lothar, for giving me the floor. Ladies and gentlemen, it is a pleasure for me to present to you the feasibility of the tricycle protocol in Madagascar. Next slide, please. As we know, surveillance is one pillar of the 5 pillars to fight against AMR. And we have been helped by the Maria Foundation in Madagascar to conduct those surveillance. As we can see on the slide, the tricycle protocol, which has been launched by some experts from the WHO, has as aim to assess the prevalence of ESBL coli in 3 sectors. Firstly, in human, secondly, in animal, and thirdly, in the environment. Thanks to Maria Foundation, we could conduct the first 2 years of tricycle surveillance, and the third one has been helped by the SIDA, the Swedish International Development Corporation Agency. So we completed 3 years of surveillance of the ESBL coli. The result was striking because the first year we found that in pregnant women, we found 32.8% of carriage of ESBL coli in pregnant women. The second year, it has risen to 35.5%. And the third year, I didn't put here the result because it's not an official result yet, but it is around 28.8%. So there was a decrease in the third year. But as we can see on the slide, there was the pandemic COVID-19 between the year 2 and year 3. So that explains perhaps this decrease, because there was the use of protection for all the persons, and also the increase of this protection in hospitals. But in the animal, the first year it was 56%. The second year it has risen to 71.1%, and the third year it was 72.1%. So there was a progressive increase in animal carriage of ESBL coli in chicken, because we did the samplings in the SICA of chicken in the markets. And the third one is the environment, and we had the result of slowly increase in the different results, because the first year there was the downstream samplings of water. It has been increased from 2.4 to 2.6 logarithm colony forming unit per 100 milliliter. And the third year, it is likely the same. For the slaughterhouse, 4.1%, 4.3% for second year, and 4.6% in the third year. So there was a slowly increase of the existence of ESBL coli in the environment also. On the map of Madagascar, we can see the different places where we did the samplings of the human carriage in pregnant women of the ESBL coli. Third slide, next slide, please. We did the sequencing of the strains that we discovered in those surveillance. And the striking result is that we found an intrasectorial and also intersectorial strain circulation of the ESBL coli. The intersectorial strain circulation has not been discovered in developed countries. So that explains the different discoveries that we found from developed countries and low and middle income countries. We can see from this presentation that 3-cycle protocol is easy if leadership is effective in the countries where we implemented them. It is feasible, and we would like to stress on the fact that collaboration is very important. Collaboration between research centers, collaboration between public laboratories, and collaboration between different ministries in those different countries. We would like to stress also the fact that the existence of a national laboratory network is very helpful, because it helps us a lot to collect data from those different laboratories. And the 3-cycle protocol can be improved because we can detect also the CPE with the Triumph protocol that we implemented later on, which is the detection of carbapenemase producing Enterobacteriaceae. I would like to thank you for your kind attention.
Thank you so much, Luc. Really interesting to see, with concentrating on some data directly, you see the impact, and can prove this intersectorial exchange, which is obviously a huge knowledge. Cool. And then we move on to Carolee Carson. She's Surveillance Manager, Analysis and Communication Lead of the Canadian Integrated Program for Antimicrobial Resistance Surveillance at the Public Health Agency, and her title is Canada Experience Translating Data to Policy. Please, Carolee.
Thank you very much, Lothar, and greetings, everyone. It's my pleasure to be here today, and thanks very much to the organizers for this opportunity to talk about what we do in Canada for integrated surveillance of antimicrobial resistance and how this relates to action. Next slide, please. The Canadian Integrated Program for Antimicrobial Resistance Surveillance, or CPARS for short, started in 2002, and it's led by the Public Health Agency of Canada in conjunction with multiple federal departments and many external stakeholders. What you can see on this particular figure is that we have surveillance in humans for antimicrobial resistance and antimicrobial use, and we have surveillance at multiple different points in the food chain from multiple different animal species. On the bottom half of the figure, you can see that we also have antimicrobial use or sale surveillance in plants and in animals. In terms of the types of action that have been taken based on the data, there have been voluntary antimicrobial use changes, antimicrobial product label changes. The data have been used in both pre- and post-approval monitoring of antimicrobial drugs sold for use in animals. So these are human safety evaluations, and the data have been used in risk assessment. Next slide, please. I wanted to show you one example of how the data have been used for action. And this is a story about chickens and people, about a particularly nasty strain of Salmonella called Salmonella Heidelberg, and an antimicrobial that's considered in the class of critical importance to human medicine, and use of this antimicrobial class in chickens. So I mentioned that we began in 2002, and this particular image you see on the screen is a snapshot from our 2003 report. So we were brand new then, and we had, I would say, barely able to call ourselves integrated. We had, in some cases, limited geographical coverage of our data. And what this slide shows is that resistance to this particular drug and this particular strain of Salmonella was higher in one province, which you can see in the blue and the purple, than another province, which you can see in the pink. And when we released this data, the types of questions we were asked were, why are you focused on chickens? What is happening in other animal species? And the answer for us at the time was, we only saw it in chickens and people. The next question that we got asked is, well, what's happening in the other regions of Canada? Canada has 10 provinces and 3 territories, and these are only 2 provinces. And our answer was, we didn't have surveillance yet in those other provinces. The next question we got asked is, well, what's happening with antimicrobial use on these chicken farms? And our answer was, we didn't have use surveillance at the time on those farms, but we did have a large research project in that province with the higher levels of resistance that indicated that this use practice was widespread. Next slide, please. So now I want to show you what happened with that information. What you can see on this slide in the blue lines, this is information on this strain of Salmonella and resistance to this class of antimicrobials in chicken purchased at the grocery store. And the green line is what we saw in people. So when we released that image you saw on the last slide, the provincial ministries of health and agriculture in that province with the higher levels of resistance reached out to the poultry industry. And within weeks of receiving the information, the poultry industry met and stopped voluntarily the use of this antimicrobial class. So if you look at the figure between the years 2005 and 2007, when they stopped that use, resistance declined, both in grocery store chicken and in people. But the poultry industry went back to using that drug on a rotational basis with another antimicrobial, and you can see those lines. Resistance increased again. In 2013, the poultry industry launched surveillance with us. And at that time, from the Sentinel site surveillance, we could see that 31% of the farms were still using this antimicrobial class in the manner. And they also launched resistance testing on those farms, which is what you see in the red line. So at the beginning of 2014, nationally, all of our producer organizations decided on a formal elimination of the preventive use of this antimicrobial class. And you can see what happened. All the resistance lines decreased. So for this particular example, what made this happen was that we had harmonized data. We looked at the same bug, that same strain of Salmonella in animals, meat, and humans. We looked at the same antimicrobial and we tested it in the same way in the lab. When we went on farm, we looked at the same antimicrobial class for use surveillance, and we had centrally collected information. Once we had the information, it was a simple graphical presentation of the data to those who could take action. Even though at the time we had limited data in terms of scope, it was harmonized data. And with that, I'd like to conclude. Thank you very much.
Thank you so much, Carolee. Again, a somewhat different approach, but very convincing. Again, Carolee, you show how much you can influence action by data. Now that's what we're talking about. Thank you so much. So the last speaker in this lightning talks now is Rangtip Chuan-Chen. He's professor at the Department of Veterinary Public Health, Faculty of Veterinary Science in Chulalongkorn University, Bangkok, Thailand. He's talking about regional perspectives in developing and implementing AMR and AMU surveillance across sectors. Rangtip, please.
Thank you very much for the introduction. And the region I will talk about is Southeast Asia. Next, please. Yes, Southeast Asia is an AMR hotspot. So back to 10 years ago, the implementation to address AMR in this region was rather behind. There was no national AMR and AMU surveillance in any country due to the lack of capacity. And with the support for many international organizations, national AMR and AMU data generation has been improved. And now there are at least 2 countries implementing the integrated surveillance, which is highlighted in green. And right now, all countries are aware of the program. But however, it is not easy to implement the effective national surveillance in each specific sectors. And this also applies to the integrated program. And I cannot predict now for the future because there are so many things and many factors that what affect the implementation. Next, please. There are many things required to be settled before developing and implementing an effective program in this region. And the important prerequisites is in the dark blue include 1, the existence of human and veterinary services that allow proper sample collection and microbiological examination. And 2, the qualified laboratories and well-trained staff that play an important role in AMR data generation. And the last one, available funding resources. That seems to be a bottleneck for most countries and affects the sustainability of the program. And this is because most of the country rely on the external funding that may not last very long. Next, please. And Thailand has implemented the integrated program since 2016. We have faced a quite number of challenges and learned so much as well. And 5 key lessons to be mentioned here are, the first one, the important first step is increase the visibility of AMR to high level or to be national priority, and also develop mechanism for multi-sectoral collaboration. So for easy speaking, good governance is a must to ensure the collaboration. And the second, it is necessary to get all stakeholders involved at the beginning, and at the same time, build trust and respect among them for sustainable collaboration. However, the progress varies among sectors, depending on how they prioritize the AMR and how they contribute to the National Action Plan. And the third one, it is important to build and strengthen skill and capacity by using harmonized methodology and data management across sectors. We suggest that building on existing activities or program. And the fourth, monitoring and evaluation should be prioritized action and developed in parallel with the implementation. And the last one, the budget allocation. Actually, the funding is available, but fluctuating. Thailand National Strategic Plan is mainly supported by Thai government fiscal budget and also some funding from the donors. Even though it is a routine resources, but the budget may be also allocated to another issue like COVID situation. So we have to secure sustainable and sufficient funds for long-term implementation. So I will stop here. Thank you very much.
Thank you also, Rungtip. Very clear strategic process that you showed us. And just let me summarize what we have seen in these 4 talks from regional or national experiences. What we're seeing is in each of those, these started at different levels, but they all progressed. And obviously, it all was helpful and led to action, which is, I think, this is exactly why we need surveillance. And these are great examples. Thanks again. So for the audience now, what we are doing now, we are moving into a moderated panel discussion with 4 panelists. And after this moderated discussion, we go into the Q&A session, which is open to all of you. Please give your questions to the chat, and Suzanne Young will take care of it so that these questions will be answered if possible. And if those that won't be answered during that time that we spend together, they will be answered later on by personal contacting you via emails or chat. So I have in this panel 4 persons. First one is Muna Abusin. She's ambassador on antimicrobial resistance of the Federal Ministry of Health in Germany. The second one is Lisa Inda. She's director surveillance, disease prevention and control division at the Caribbean Public Health Agency. The third one is a cat, obviously. I don't have her on my list, but maybe, I see. So the third one is Joachim Larsson, professor of environmental pharmacology at the Department of Infectious Disease, director of the Center for Antibiotic Resistance Research at the University of Gothenburg in Sweden. And the last one is Jaap Wagenaar. He is professor at the Faculty of Veterinary Medicine at Utrecht University, the Netherlands. And this is important in this circumstance here, he's co-chair of the quadripartite technical group that has been presented by Chiniri in the beginning. So let me ask, first of all, Muna, now listening to these presentations. And knowing that you have been for a long time, and you're seconded, as far as I know, from the National Public Health Institute in Germany to the ministry only recently. So looking at what you've heard here, what do you think are, how important are national public health institutes when it comes to surveillance of antibiotic usage and antibiotic resistance? Muna, the floor is yours.
Yeah, thank you very much. And as you mentioned, I have been seconded by the National Public Health Institute, the Robert Koch Institute, but now having another perspective, more the policy perspective. And I think a key, and that came through all those presentation and talks and lightening thoughts. This is really the communication. And the communication, we do to reach policies, stakeholders, politicians, to really engage and to put that on their agenda. And the Public Health Institutes, of course, coming from the Public Health Institute, I think the communication we have to do is also key in that. And as we have having the public health perspective, really understanding what our public health needs, where are really the major challenges in this context, and particularly also across the sectors, because public health, of course, is human health, but animal health as well as environment. We need really to be empowered as well, and to be engaged, to be able also to lead the coordination across the sectors. The oversight of surveillance activities within the sectors need to be brought to this coordination level as well, to integrate and to report on all those data we gather. And if I just may come back to the communication, I think it is extremely important that we try, particularly also in this year, to reshape a little bit how we approach surveillance. We have been talking a lot about the antimicrobial resistance and antimicrobial use surveillance as well. Within the different sectors, public health institutes are at the upfront and are really the ones who are collecting, interpreting, analyzing, communicating a lot of this data. But what is it all about? We really want to keep and to ensure that antibiotics remain effective. Yeah, and that also means, again, a core functionality of public health. That means the prevention aspect needs to re-emphasize. That means we should really try to not to lose or not to really to keep every potential opportunity to avoid using antibiotics. We really need to re-emphasize. So this is prevention. Prevention should be really a core aspect. And I think we need to integrate also indicators on water sanitation, on infection prevention control measures, on vaccination, to have a really integrated approach and really to make also the case for targeted interventions, but also to say what we want to reach. And if we discuss in this year, where the United Nations high-level UNGA meeting is foreseen in September, we have a lot around the targets discussion. So what do we want to achieve? And I think surveillance has also a core function here, and we need to emphasize that. Over.
Yeah. So of course, I can only echo this. Obviously, prevention is also on my mind, Muna. But when we go to discussions, you're talking about communication. Obviously, there are different views on different stakeholders and on different regions worldwide. For example, access to antibiotics in several regions could be considered to be more important at that particular region than specific use of antibiotics. So how, when you talk about communication, how can you leverage all these different things without confusing politicians? This is a question. I mean, we all getting this, we all experiencing this. How do we make it possible that this different needs and messages are not intermixed and misused, obviously, because what we learned from COVID also is that misinformation is at stake a lot. What is the recipe from a policy advisor, the German ambassador Muna? Then I would move over to Joachim.
This is key as well. And I think we need a unifying overarching objective. So again, and I think the Lancet series, for example, they made also the case for that. We need to have the need for sustainable access to effective antibiotics. This is, if we can agree, if we can really message this, and this is an echo of the Global Action Plan from 2015-16, but still we know this Global Action Plan lacks a little bit the environmental dimension, but it's still very valid. The continuity of successful treatment and prevention of infectious diseases with effective and safe medicines which are quality assured, used in a responsible way, and accessible to all who need them. Yeah. I think if we really can make this, and this is really something rather. Instead of talking about antimicrobial resistance and the challenges and the complexity, we are all aware of that. But if we really want to go beyond our AMR community and really reach politicians and really go over the boundaries, I think we need this unifying objective. And there already everything I feel is included. Is that we really need to focus on prevention, that we really need to ensure access to effective antibiotics. And again, coming back to surveillance, I think if we have indicators for infection prevention integrated as well, for access as well integrated to antibiotics within our systems, and not only measuring antimicrobial resistance, not only, but focusing on antimicrobial resistance and antibiotic use consumption data, but really add those indicators within our systems, we really, I feel we have a better story, and a story which is really about people and systems, instead of pathogens and drug-bug combinations.
Yeah, that's a cool saying. It's exactly the issue. It's about people. No? It's not about pathogens, but it's about people and how they profit from it. So Joachim, turn to you now. I mean, obviously, you're one of the leading guys when it comes to environmental surveillance issues and environmental AMR surveillance. You didn't hear too much in these lightning talks about the environment. What is your key point on this? And why is the environment monitoring important? And actually, what are the thoughts behind environmental surveillance of AMR, Joachim?
Yes, thank you, Lothar, and thanks for all the inspiring talks as well here. I think the environmental surveillance can serve a couple of different objectives. Important one is, of course, to understand the environment's role as a transmission for resistance microorganisms between different compartments. Another potential use is to actually use the environment as basically as an indicator of what's happening in the population. Basically, as we have done for COVID surveillance in sewage in the last few years. So that's also an opportunity, of course. But getting back to the talks here and the reflection of that is that I think that when we design surveillance systems, whether it's environment or anything else, we need to think about what is the exact purpose of our collection of data. And we heard in the quadripartite presentation, for example, that we need to start in the of what we're going to have the data for. And I like that very much. But I didn't hear much today about what I think is the most important specific kind of decision that should be guided by AMR surveillance. And Those are the decisions taken basically every second by doctors and veterinarians across the world on what antibiotic should I give my patient. So rapid diagnostics, of course, would be lovely, but in reality, 5% of all treatments across the world are empirical treatments without detailed diagnostics data. And that's even in high-income countries. So in those cases, the doctor's decisions rely on surveillance data. And this is ideally regional, up-to-date statistics on probabilities that different drugs will or will. And I think that creating such surveillance data to inform empirical treatment in all countries should be a #1 priority, because that's so critical. And coming back to the environment then, as you asked about, Lothar, if you have good clinical surveillance data, the doctor is not very much helped by environmental surveillance data in his or her decision, right? In a country that doesn't have clinical surveillance data, maybe wastewater surveillance could be useful. We'll see if the future will show us that. On the other hand, if you want to take this management, you'll need environmental surveillance data. You're not very much helped by the clinical surveillance. And of course, if you want to reduce transmission between compartments, you need data from all three compartments. So my point is that we should start by prioritizing exactly what decisions that needs to be informed. And based on those decisions, we should identify on a case-by-case if we need support from integrated surveillance or largely from one domain. We certainly need surveillance in all domains for informing some decisions, but maybe not for all decisions. And this also relates to what kind of data that we are collecting. If we want to investigate transmission across different compartments, we are very much helped by genetic data. But for the doctor, it's basically susceptibility data that is the really important thing. So a second take-home point is that the type of data that you collect will depend on the decision you want to inform. So when we talk about harmonization, we need to think about there's lots of different decisions to inform, and each of them have different use of different types of data. So we need still a variety, I think. Thanks.
Yeah, thank you so much. Amazing that you talk so much about clinical decision. Yeah, but I mean, in the end, it's exactly, I mean, we want to serve the people and the environment and the animals, and that's for sure. And I liked in particular you're saying about different surveillance tools are for different purposes, and something that I basically experienced over the COVID-19. Suddenly, some politicians thought, "Oh, let's go back to wastewater because we have so much information out of this," and they reduced even helpful clinical surveillance because wastewater is much less cost intensive. Yeah. Mm-hmm. So this is also, but as you said, it serves different purposes, and this is also something I take from my time as a director of the Robert Koch Institute. You know, it has to be purpose driven, and it's hard to make the politician decision makers clear what purpose does fit best, because they want the magic bullet as cheap as possible that serves all these. And I think this is something especially the wastewater surveillance should really always be clear what it can really be based on, what decision it can drive or not. This is a very important discussion. Thanks, Joachim. I go to Lisa now, the woman from the Caribbean, who I guess will be very tired because it's the middle of the night, more or less. Sorry, Lisa, to get you up here. So what is your take on this when it comes to countries on your level? How do you support a specific country to make it happen? How do you convince the leaders to make it happen? Are best practices from other countries helpful? And if so, should these countries be countries in the same region, or could it also be a country from a totally different region, which for politicians or sometimes is a challenge? What is your take on this, Lisa?
Thank you, and good morning, afternoon to everyone. It's really a privilege to be here. So I'm from the Caribbean Public Health Agency, and just to give a bit of a context, we serve 26 member countries, and some as small as 60,000 persons, and some, you know, a bit as large as 2.2 million. But the thing is, they are all autonomous countries with their own separate governance. And so your question is very interesting in that, how do you get countries to work together on any topic? And for us, the way we work is through different coordinating mechanisms. So CARPHA is the Caribbean Public Health Agency, we have an IGA that works with countries to, you know, to provide technical guidance in terms of what we see important for public health. But it's not as easy as just saying, well, this is important. We have to provide the data. We have to show the impact. And we have to also provide that information for the policymakers. And as you said, also, the policymakers wants to hear 2 and 3 sentences. They want to know how much debt, what's the cost, and what do I need to get it done. And from where I sit, while all of what has been spoken is important and true, integrated surveillance is very challenging. Jaap would tell you, we started to talk about integrated surveillance since 2005 with foodborne diseases. And at that time, we were attempting to bring the lab and the epidemiologists, the veterinarians, and the environmental health persons to bring data together. But we always try to emphasize this 4 C's to integration. The collaboration is important, but collaboration has to be something that is, you know, demonstrated. Because what does collaboration mean when you have different countries? So you have collaboration within the country among the different labs, the clinical, the food, the veterinary, the environmental lab. But then you have to have collaborations between Ministry of Health, Ministry of Agriculture, and collaboration among the countries as well as the agencies. So where we sit, we are working as CARPHA, we are working with PAHO and many international agencies. So we have to collaborate along. And then there's a whole coordination. If we're talking about integrated data sets, there must be that agreement for data sharing and for cooperation, as well as the coordinating, because the data is sitting in different places. You may have an international organization like FAO, may have agriculture data. You have the countries that may or may not share because of turf issues. So you want to really have that coordination. So from where I said, one of our biggest challenges is how do we get people to work? It comes down to people. If we get them to agree to work and to share data, we can really then push to have that integrated surveillance. Because there's a lot of work that is being done. Like this week, I opened a workshop at the veterinary school in Trinidad, and they're talking about a One Health approach, but it's still fragmented down to the animal side. We need to get the animal and human health and environmental to work together, but it has to be a situation where we are walking that talk. And so for part B of your question, how does it help? This international type of forum and the work that's being done, you know, by international bodies and other countries is key for us, because we can use that as evidence and to say this work in this country, there, this is the number of deaths, but this type of partnership and coordination and harmonization and sharing of data and so on is important. The other thing that is lacking in the country is lack of legislation. So for instance, data on antimicrobial use is very challenging to get. And the proper use of antibiotics is almost, you know, non-existent. We have limited data, but the data that shows that if a child goes to a doctor, the first thing they're prescribed is antibiotics. Antibiotics are used in feed and in water for animals. So it has to start, you know, that farm to table approach going along in the Caribbean, and I'm sure in other countries, but we really have to bring the coordination, the collaboration, the farm to table approach, get them all in one place, and also show them the international impact, you know, what have happened at the international bodies that we can then take and pass it on for the Caribbean.
Thank you, Lisa. So you obviously touched the complexity issue. with which we are all aware. You touched the issue that you have different levels in different countries, but I particularly liked, and this is a common theme, obviously. I mean, it's all about the people. It's all about trust, you know. Trust people. This is the basis for everything. You know? Otherwise, we won't move ahead. And this is something that currently in this world is not the easiest currency. You know. So as I feared, we are running out of time, and we want to give the auditorium also the time to ask some questions. So Jaap, you are the co-chair of this technical group. Just your 2-3 most important takeoffs, then we go into the discussion with the auditorium. And I welcome various members of the GLG group, which are online. Thank you for being here. But I also want to, again, please ask your question in the chat. Susanne Young will give it to me, and you will have time we'll have time, at least 20-25 minutes to discuss. Jaap, what are your main messages to reach the goal of integrated surveillance?
Yes, thank you, Lothar. I think that the trust that was already mentioned, sharing data is extremely important. I think there is a lot of data, but I think finally coming to the point of sharing is crucial. And I think that is also, a lot of people do not have to start the collecting data for the integrated surveillance, but using the data that is already there. Might be not perfect, but I think always useful to share. And sometimes there is, in particular from the animal side, I'm a veterinarian, I know that sometimes there is some hesitation of sharing data from the animal side for economic and for trade reasons. But I think earlier or later in countries, there will always be now academic researchers who show something, maybe not even representative data, but these data are always popping up. And when you are then as a government not in the coordinating role, I think it's much more difficult to do the proper communication about the findings. So sharing data, I think, is a must, and trust is an extreme important one. Second point I like to make is that within our group, the technical working group, we also have clear focus on that not all the countries have sufficient resources to work on the same level. And I think that we can build a Rolls Royce, but we can also do a smaller car. And I think that's what we are aiming for, that for all the different levels that there are tools, that there are systems to work on. And even when you can do it with simple methods, I think you can reach already a lot. And I think the last point is that I've a long list, but I will then mention as a last point that it is important to have an allocation of resources for a longer time, because it's not very useful to do it once. I think when you look for the aims, it's also looking for trends. And then you need an allocation of money for a longer time. And I think I have more important points, but maybe to stop with the challenge that we have, I think at least for what I feel is that, and as mentioned already by Lisa and by some others, that for foodborne pathogens, it might be the easy ones to do integrated surveillance. When we pull the environment, it's more difficult. Aquaculture is more difficult. But for me, I think that the challenge and for the group is also to include plants. And that's a world that is not often mentioned. But I think also it's important to include that sector as well. And then I give the floor back to you, Lothar.
Thanks. Yeah, interesting. Plants, yeah. Interesting issue. So again, complexity, but what I also like, as you mentioned, various different countries are on different points. Some countries have enough data, but you don't have access to it. So you have to look into each and every country, region, and you have to define the objectives why you do this. So you have to prioritize. Would there be in the technical guide that will come out from your group, would there be something like a prioritization list or a map what is at what stage and has developed over the world over the last years or so?
Yeah, now we have prioritization definitely in our guide. We also have a scheme. We are still discussing it, but that people can step in different levels for integrated surveillance. Yeah, that's I think the most important. We have that in mind, and to bring in different levels. Yes, definitely.
Yeah. And then we need these nice dashboards that are interactive. Let's go for it. In this. So I open the floor now for questions. So again, the participants, those who will answer these questions, are both the four guys from the panel as well as those who spoke before the lightning talk. So we have enough expertise here, and I just throw the questions into this round. My problem here is now I don't know who wants to answer these questions. It's not so easy for me to have a hold on this. But the first question is by Satyajit Sarkar. How do you define better data? Who wants to answer this question? Is it the guy here from the technical group directly, Jaap? Or is it somebody else? I don't know. How do you find better data? It depends on the purpose, I guess. No? Jaap, you want to take this? And Carolee takes the lead here. Cool. Yeah, please, Carolee.
Maybe I'll just get it started, but it actually, Lothar, you touched on it. The data should reflect the purpose of what it's being used for. So that to me is key number one. It should be representative for that purpose. And so there's quite a distinction between data required to look at a trend over time with confidence versus data that's identified something new, new resistance pattern in a new bacterial species. And if it's across different One Health sectors, then the data need to be harmonized. It's very difficult to compare then across the sectors if they are not harmonized. And I think the other big part of it is that with any data, the clear strengths and limitations of the data, so the communication aspect that must go along with the data are essential, so that if you have more uncertainty about the data, that needs to be communicated. And we have an example with the Canadian program that for any component, if we're looking at trends over time, if we have fewer than 20 isolates that are collected, we flag that just to acknowledge that we have less certainty about that data. Thanks, I'll stop here.
Interesting. So it's about transparency again, no? Which is the basis for trust. And I mean, that's something that is pretty knowledgeable to, I hope, all of us, but it's not always in the interest of one or the other political decision maker. So that's obvious, interesting case here. Abu, you all, Muna, you also raised your hands, I see.
Yeah, just to add what Caroline so nicely elaborated. I mean, it is really purpose driven and the objective of all. But that also means representativeness, as was pointed out, but as well as relevance. I mean, we can have a lot of very good data, which might more or less be relevant to our objectives, and this is really something important. I also think we need to connect to and address.
Thank you, and I see that also Lisa raised her hands. Lisa, please.
Yeah, and to add to all of that, I mean, the data that is coming, I mean, it should be obviously from the multi-sectors, the animal, the human, environmental, but also the timeliness of the data. You need to be able to share data that is timely, that will make a difference for public health action.
Joachim.
My colleague Ramanan Lakshminarayan, he always stresses that data should also be actionable. Yeah. In addition to the things that you've talked about. Data that you cannot act upon is not as important as those that you actually can act upon. So that's another thing to add.
Yeah, absolutely. Great points. So I move to the second question. It's from Carmen Boulon. She's asking, could you explain a bit more in detail which are the legal burdens that hinder data sharing. That is, I think, very much depending on the local national situation, but also, of course, on international treaties. I think this was raised, if I'm not wrong, by Lisa. Jaap, Lisa and Jaap. So first we take the woman, of course, and then we take Jaap afterwards. Lisa.
So, it depends. So there's just the data that is being shared by country, ownership of data. They own, a country may own the data, and then there's the sector, agriculture, health, or the private sector. Ownership is important. That also prevents data sharing. So one of the things that is important, and this is where you have to build trust. And in building the trust, you create data sharing agreements. What are you sharing and what is it going to be used for? If there is going to, the data that is going to be used for action, which is what is important, you know, what the agreements on the elements to be shared, as well as, you know, if there is a publication or something, everyone is involved. But you have to go through all the different hoops of, you know, at the levels, the different levels, whether it be at the sectoral level, and then at the national level, and then at the agencies. So it does require a lot of legalities.
Yeah, I mean, before I give the word to Jaap, I just want to also bring into the context here the so-called pandemic treaty that, you know, when I chaired the IHR review committee in 2020, one of the recommendations we made obviously was a pandemic treaty, and obviously sharing of data about pathogens as soon as possible on a global level, which is just another level. And I fear that this will not come into living, which is actually a pity, because we already experienced how important this would have been. But anyway, so let's go to Jaap now.
Yes, regarding the sharing of data, besides what is already said, I think it's important to mention the systems of FAO in farm, where data are collected, and the ANIMUSE system of the WOA, where they collect data on antimicrobial use. And I know the animal side the best. There they are really, really keen on how, at what level can you share data. So both organizations have a perfect system developed to what level, if you are sharing data, for example, in the farm system, if you are willing to share, you are also seek more data from other countries. So there it's a kind of an incentive for people to share data. And I think to look into these two systems from these organizations, you can learn also a lot about exchange of data.
Here you touched a very important point: incentives. No? So what is the incentivization that people would give the data? And this is something that you always have to have in mind. Peter, Jan, you also raised your hands here.
Yes, and I just want to echo a bit the incentives in Belgium, for example, in a lot of the data on antimicrobial resistance in veterinary animals are collected by private labs, and if they are not either financially incentivized or legally obliged, they do not share their data.
Yeah, you need a legal framework at least, yes, because otherwise you hinder sharing of data. No? This is obvious. Okay, here I move to the next one. This is Nicholas Deyi. He says, I would be grateful if you can share the stepwise approach and any other information to develop integrated AMR strategy, because he's asked to lead a team to develop this for Ghana. I think the secretariat, the technical group, should directly contact him here. No? Thanks for this question. Nice that you directly want to operate this. That is exactly what we like to see here. There's a question from Anne Haran. She's asking, how did you build trust between sectors? Good point. Maybe one of the speakers can give a specific example of what has helped to convene sectors and improve the willingness to work together and share data. Anybody from the speakers and panelists who has, I mean, so Jan Peter, 26 groups, Must have taken some time, but I think you have a great experience there. But 3 people are raising their hands. It's Jaap, then Rungtip, and then Carolee again. And then Peter Jan. Okay, there we have him.
Yes, sure. I can give an example from my own country where we not only on AMR, but also on the exchange of zoonotic diseases. We established a group that is meeting every month, and we are exchanging information with the private sector, with the animal sector, human public health sector. It takes time. You cannot force trust. I think it's at first, in particular, the private sector was a little bit hesitating with sharing data, but they see that what they share is not immediately making public. And also the public health officials, they see that they need the data from the private sector, and in that way, they are dealing in a very, very good way with these data. And now we are doing that for zoonotic diseases. I think at the animal side, with the example from the Netherlands, where we have a 77% reduction of antimicrobial use in the animal sector over the last 14 years. I think we showed that it worked.
Yeah, but it's a stepwise procedure, no? I guess that's you can't do it all at once. You have to be patient. Rungtip.
Yeah, so I think our strategy in Thailand is just similar like what just Jaap said, because went back to 2014, okay, when we started the national AMR surveillance in Thailand, okay, so we invited all the stakeholders, okay, to meet, okay. I cannot remember how many times that we had a consultation meeting, we had a meeting, so we talked to them why is it so important to have like the AMR surveillance, and we also always include the private sectors, because these private sectors usually very careful, about sharing the data, about giving the data, but they are very important part, to address the AMR in my countries. And also we all have like a national AMR forum every year. So this is a stage, that all the sector come and they meet each other. And whenever we have anything new, okay, like maybe data guidelines or whatever, not just only one sector will do. We will always share, and ask comment from all the sectors. It may take long, but usually we can keep them with us, and they will contribute, to whatever is about this. So we build trust. Just make it transparent, that everything will be just fine for everyone. So we are doing that for the countries. Yeah.
Yeah, sounds reasonable. Cool. Carolee.
Thank you. I think it's really important to, in planning for integrated surveillance, to dedicate resources and time for this. It is so vital. We started with, even within the federal departments. So we have right now, since 2011, we meet monthly to talk about antimicrobial use and resistance. And we have 6 federal departments spanning environment, fisheries, health, food, and agriculture. So that's within the government we meet. And then once a month, the government meets with the provincial and territorial representatives. So we talk what's happening in the region. And then once every 3 or 4 months, those groups come together and we meet with industry. And we talk about anything that's happening in the different sectors. And then once a year with our surveillance data, we hold a webinar during World Antimicrobial Resistance Awareness Week to share the latest data from the previous calendar year. And all the sectors are invited to participate in that and ask us questions. And if we do also meet with each sector individually. All is to say this takes time. And so it's really important to build that trust. You have to just plan for that time and plan the resources for it. Thanks.
Thank you, Carolee. Peter Jan.
Just to add to all what is said, I think looking for win-win situations is always very good. And so what helped in Belgium again was that the convincing argument that by coming together that you increase your own exposure. Let's say you get a bigger platform. And that also it's really helpful for funding opportunities, also for research purposes. So that's often a good argument, I think, also in my experience, to help establish collaborations in the One Health field.
Great point. In addition, yeah, common interests strengthens your possibility to get resources. Yeah. Thank you so much. So there's another question from Diana Connor. She's saying, I'm excited to learn more about the gap analysis work done by Cesano. Can you describe that a little bit more?
Yes, but this is really a national exercise. So it's just that everybody's responsible for his or her own surveillance system. Just said, what can we improve? And that was just really. But I think that can I just maybe summarize in 2 words? And this is for Belgium. This is the IT systems. We lose a lot of time behind our screens, yelling at computers and with the data flows which are not compatible with each other between hospitals and so this is maybe more, I guess, for I don't know for your situation, but this is in Belgium something that we really have to work on, and this is an enormous gap in compatibility of IT systems nationally, but also I guess internationally also. So that is the conclusion of our gap analysis.
In Germany, it's 100% the same. Sometimes it's better you start from scratch instead of trying to get data of siloed systems. So this is really so different between countries. Thank you for this, Peter. So Tajid Sarkar is asking, guidance for generating data through integrated surveillance is great and is likely to improve with time. But important weak link in the chain is analysis of integrated data. What technical support is offered for such analysis and synthesis? That's a good point, actually. I don't know whether the WHO hub, I guess, will improve this. At least this is part of the issue. Joachim, are you volunteering to answer this question?
I want to say that it's a very good point, because it is indeed a challenge. In most cases, I think that when we talk about an integrated surveillance, it often deals with transmission, with microorganisms moving between compartments, trying to figure out how they do that to, for example, prevent transmission in some way. And the data will look very different in different situations. It depends so much whether it's phenotypic data, whether it's genetic data. And I would say in many cases, this is still at the frontier of the science on how you actually can trace directionality of how microorganisms move. So I just want to stress that, yes, this is indeed a challenge, and will probably need to engage a lot with the academic community here to interpret this kind of surveillance data.
Yeah, Joachim, that's a good point. And again, I think that this is one of the tasks or objectives of the pandemic hub, basically, that wants to develop methodologies that are then delivered and other countries, and giving them the opportunity also in teaching them in these methodologies and applying methodologies that have been developed. I think this is an absolute timely and most important issue. And obviously, artificial intelligence will come into play here in the future, because if you have totally different data sets, you can do multimodal analysis by using newer technology, which would be which will be at hand soon. I think there's a huge speeding up in tools that are available, and I'm glad. So actually, I'm glad that it fitted so well here with our time schedule. The last question, I can't present it to the auditorium, George, but you will have the chance, as I mentioned, we will answer this question then in the chat. I'd like really to congratulate all the speakers. It was a lively and interesting, really great conversation. I enjoyed it a lot. These guys that you heard here are those who really want to make it happen. They are obviously, their objective is clear. They really want to reduce AMR, and I'm more than thankful for this. Please accept my gratitude here. I'm really also pretty happy to be part of the GLG group, which is a nice group. And again, we met each other 2 years ago or so, and we also built up a lot of trust, which will support our efforts a lot. We have a great leader. the woman from Barbados. She's really a strong woman. I highly appreciate her. I'm more than happy, and every time I meet her or see her, I never met her in person, to be honest, but she's so energetic, and that's what we have to stay. So I won't summarize this. The slides will be shared with you, of course. There will be, what my takeoff is, clearly trust, because we're all people. People are doing the work, and they must trust each other. They should trust each other, and resources, and keep to the objectives, and don't let yourself be corrupted or misused by whom whatsoever. Stay tuned and stay on the objectives that you think are serving the common good. Thank you so much for all the participants. Thank you for the questions, and having a nice weekend. Bye-bye. See you hopefully soon.
Bye-bye. Thank you.
Bye.